on behalf of the church. And they can talk more about what it looks like when this policy translates into programming that reaches those most in need. Sarah.
All right, good afternoon, everyone. A sincere thank you to Catholic Charities USA for the invitation to share a bit about our work in West Virginia with you all today. We consider CCUSA a strong partner and ally in our work. So I'd like to start off by sharing a couple quick facts to illustrate the scope of the reach of the entire Catholic Charities network across the country. CCUSA serves as a national office supporting the work of 167 independent Catholic Charities agencies across the country. In 2021, this network served over 14 million individuals and families in all 50 states. Of those 14 million people, at least 11 million received some form of nutritional or food assistance through various USDA federal funding streams. Catholic Charities West Virginia is just one of those 167 network agencies. We were founded in 1931. We're the largest private social service agency in the state of West Virginia. We're also the sole Catholic Charities organization in our state. Our services cover all 55 counties through a number of program offerings addressing various needs across the lifespan. I often describe our work in our agency as mission-based. Every internal programming conversation that we have ties back to an overarching reason that we exist, why we do what we do. At Catholic Charities West Virginia, we consider ourselves truly privileged to serve. Our core values include dignity, justice, compassion, hope, charity, and quality. The basic tenets of Catholic social teaching guide our service provision day in and day out. We honor the inherent value of every person who comes to us seeking help. We believe deeply that West Virginians deserve the very best care that we can provide. Mission is just the first reason why behind the work that we do. But a very close second reason we do what we do is that the need in West Virginia is so great. Public health statistics paint a pretty grim picture of just how pervasive suffering is across the Mountain State. Anytime I talk about health and hunger in West Virginia, I tend to start the conversation sort of on a high note, so to speak, by highlighting a couple of the strengths of the state to cushion the pending blow. As most people know, West Virginia's natural beauty and landscape brings many visitors to the state, those who enjoy outdoor sports and relaxation in scenic, peaceful settings. What's not quite as well known about West Virginia or visible on the surface is that it's also home to some of the most hardworking, resourceful, and resilient people that you will ever meet. For example, when our food pantries receive thousands of pounds of potatoes in a single load, West Virginians teach one another how to can, or they bury them in their yard to preserve them for longer. Despite these inherent strengths of the state, public health statistics really do tell a different story. Food insecurity is a real problem in the Mountain State. 1 in every 7 children and 1 in 5 adults lack the proper food and resources to achieve and maintain healthy living in our communities. That's 250,000 people prior to the pandemic, which has increased to more like 324,000 over the past 2 years. There are over 200 designated food deserts in West Virginia. Food deserts are areas where grocery store access is severely limited, remote areas of the state. It's impossible to teach your children to eat salads when the nearest fresh produce is over a county away. Logistically, food deserts create the need for endless creativity and what we call operational gymnastics. For example, we receive fresh produce every year from a farm in Maryland to offices in our Webster Springs and Elkins, West Virginia. Truck drivers will navigate winding country roads for hours, much of the time without phone service, while food pantry staff and volunteers wait with borrowed pallet jacks from local businesses across the street, ready to put that well-oiled assembly line into motion, one that can efficiently, or relatively efficiently, unload thousands of pounds of potatoes and distribute them to the community in a matter of hours. This may sound pretty basic, but one misstep can really cause a catastrophe. One time I received an SOS text from a staff person. An entire pallet of potatoes broke from the truck bed lift. A pallet of potatoes spilled out into the parking lot that we share with a local grocery store. Imagine thousands of rolling potatoes. Elderly shoppers with shopping carts trying to get to their cars. Our staff and volunteers were wonderfully professional in maintaining their composure and going straight into crisis mode, but it legitimately was a major safety hazard. And despite the slightly comedic recollection today, it was a very serious incident and it was a learning experience for us. Any person, a staff, a volunteer, client, or innocent bystander could easily have been crushed to death or critically injured by that heavy load. Even the task of picking up those tens of thousands of potatoes after the dust settled in that busy parking lot created an enormous safety concern that day. Aside from a critical lack of food access in those food deserts, there are a handful of other social factors that end up contributing to the overall health of West Virginians. These factors are often referred to as social determinants of health. Things like poverty, unemployment, educational challenges, and limited access to reliable internet service top that list. Due to the extremely rural nature of much of the state, many West Virginians also experience significant social isolation and transportation challenges. Public transportation doesn't exist in most places of the state, and poverty rates are so high that many people don't own a vehicle or can't afford the gas to run it if they have one. People regularly carpool with neighbors or extended family for rides to our food pantry locations. Not only that, people will often wait to come to food pantry on a day that they're going into town anyway for doctor's appointments or other errands. Conserving fuel and ride negotiation is a very real part of life for many West Virginians. Modern advances in telehealth are really wonderful for reaching people who are shut in or those with transportation challenges, but the lack of reliable internet service across much of our state prevents this technology from benefiting most West Virginians. So, what is the ultimate impact of these layers of complex needs in West Virginia? Well, statistics don't lie, and the data is pretty clear that the ultimate result for us is poor health. We are number 1 in cardiovascular disease prevalence in West Virginia, number 2 in diabetes prevalence, and first in deaths from diabetes, first in obesity prevalence, fourth for preterm birth rates, first in drug overdose deaths, 8th in suicides, first in accidental deaths, which is not inclusive of the overdose deaths. It's more so attributed to the geography, the lack of phone access, inability to get to people quickly. Second, in cancer-related deaths, we have a lot of retired coal miners in the state. We also have a really high rate of tobacco use. And the life expectancy of a West Virginian ranks 50th out of the 50 states at 74 years. How are children specifically impacted by hunger and other social determinants of health? Children have a higher rate of developmental delays due to nutritional deficits, increased behavior challenges at home or in childcare settings, difficulty in school performance, both behaviorally and intellectually, mental and emotional problems, and then general physical sickness and symptoms. These are the children that end up in the nurse's office day after day with belly pain and headaches, digestive problems, those sorts of things. So how do we help with all these complex issues? At Catholic Charities West Virginia, several of our program locations utilize USDA funding streams for service provision. The Emergency Food Assistance Program, or TFAP funding, helps to support our food pantry program statewide. We provide services in 15 food pantry locations, serving nearly 6,000 individuals and families in 2021. Those families received 446,000 pounds of food. We operate both traditional and what we call mobile food pantries in certain remote counties of the state. In Wheeling, West Virginia, we also provide congregate hot meals on site. We serve up to 50 people in a given day. That's 75,000 meals a year out of that site. Between hot meal operations, our Wheeling staff and volunteer fleet deliver 230 meals to the homes of those who are unable to get to congregate meals. So people with mobility limitations and other disabilities, people with transportation challenges, and the elderly are some of those who rely on this care on a daily basis. The Child and Adult Food Program, CACFP, provides reimbursement for healthy meals to 231 home child care providers through our agency, and that's about 526,000 meals that we provide help with in 2021. Our Supplemental Nutrition Assistance Program, SNAP Outreach, assists West Virginians in submitting 680 SNAP applications in 2021. 86% of those applications submitted were qualified and approved for benefits. In Elkins, West Virginia, we participate in the Commodity Supplemental Food Program, or CSFP, through partnership with our 2 local food banks, providing prepackaged healthy food boxes for 50 seniors every month. This is in addition to regular TFAP food pantry services. And then beyond direct food assistance, we provide additional services to families covering a variety of needs. The vast majority of those families that we serve qualify for WIC and TANF assistance as well. We provide emergency financial assistance to prevent utility shutoffs. We provide rental assistance and car repair assistance for people to get to and from work. In Wheeling, our Relatives as Parents program supports grandparents and other relatives who've stepped into that role of parent for children in their lives. Sadly, the opioid epidemic, like we mentioned, has claimed so many young parents in our state. Our staff do everything from educating relatives on local resources and how to get public benefits to hosting an amusement park picnic for families each year. Our Child Care Resource Center locations provide childcare subsidies for working parents across the state, in addition to providing ongoing support and training for childcare providers every year. Our West Virginia Birth to 3 program team provides early intervention screening for children with developmental delays and connection to needed in-home therapy providers. We also provide immigration and refugee resettlement services, disaster services, and adult education services. Our home care program provides in-home caregiver services for seniors and people with disabilities in 16 West Virginia counties. The vast majority of those who receive the home care services are Medicaid waiver beneficiaries or VA waiver beneficiaries. Most recently, we've been working on a new hospital transition program in partnership with 3 local community hospitals, WVU Medicine Wheeling Hospital and Cabell Huntington Hospital and St. Mary's Medical Center in Huntington, in hopes of providing additional safety net support to hospital patients upon discharge. For this project, we're also working in partnership with University of Notre Dame's Lab for Economic Opportunity to design and implement a research study to evaluate the impact of working collaboratively to serve hospital patients who are most at risk for hospital readmission. Impact evaluation is important to us because we want to be sure that we're utilizing all of our resources to provide the highest quality care to those we serve. So, in summary, what we've learned in some of those past 90-some years of service to our West Virginian friends and neighbors, a few key lessons sort of float to the top of the list. Firstly, we've learned that systemic changes in mindful legislation are critical for poverty reduction in our communities. We urge Congress to pass effective child nutrition reauthorization bill, and we also ask that Congress maintain a strong nutrition title in the Farm Bill. We've learned that stigma around rural hunger has harmful effects that impact generations of people living in poverty. We've learned that childhood hunger is often experienced as trauma with lifelong health impacts, evidenced by some of those public health statistics that I shared. We've learned that social determinants of health matter. This is where we believe that our expertise kind of lies in the puzzle, our specific part to play in response to the needs that we see around us every day. And we believe that solutions require strategic community collaboration. We feel strongly that we never want to reinvent any wheels. We also do not want to compete with other service providers in the community. We think we can have the greatest impact when working side by side in partnership with other agencies, both public and private. We are ever mindful of resource leveraging and funding stewardship. When funding is allocated toward our programs, I guarantee there is always strategic and collaborative conversation happening behind the scenes. Our goal is always to stretch those dollars as far as we can. And then lastly, we can always do better. A pessimist might say that our work will never be done, but inherent in big problems is great opportunity for big solutions. Opportunity to continue solution-oriented community-level conversations and to keep trying. This is where hope and motivation for change lies. Every dent we make in alleviating suffering for another human does matter. Thank you so much for your time today. With that, I will pass to my